So now let's talk about different strategies that you can use to get the upper hand when you're interviewing for your first nursing position. Now, the first thing I would say is ask questions, and I think that's more of what we're going to focus on today is ask questions. And this usually comes at the end of your interview, right? When you're done interviewing, most times the interviewer or viewers, if they're more than one, would ask, do you have any questions for us? And that is literally your opportunity to shine, especially if you feel like you've not had a good start to the interview. Now, what do I mean? So, here's one question that usually takes people aback and, makes them a little shaky because most times they don't expect it. Is, so can you tell me about your career as a nurse and what nursing has done for you? So those are like two questions, right? Two in one questions. You would mostly see people be like, oh, nice, that's a good question. That's a hard one to think about. And their brain starts to work. What that does for you is now it gives you time to think about, okay, what strategic question can I ask while this person is thinking about this question that maybe you care about, maybe you don't care about, but they care about it because it is directed towards them, and it's puts them in the same position that you are in. Example, like asking questions that you most likely are not prepared for. And then you can go on to the next question, sorry. And that question could easily be, oh, what learning opportunities do you have for me as a new grad nurse? I'm very passionate about self-development. I'm very passionate about bringing the best to the team and growing myself, which is self-development. So how can you help me actualize that? So that's a great question that makes them know that you're committed and you're someone that wants to be good. You want to be better for yourself and by default better for the hospital, because most times new graduate nurses might quit after the 1 year is done, before the 1 year is done, and there's just some people that they just don't want to do anything, they don't want to join councils, right? So that makes them think, this is a good person. Like, we're thinking longevity, right? We're thinking commitment, we're thinking long term. You can also ask, oh, that's wonderful. I have heard so many things about the political atmosphere in the nursing profession. As the opportunities for me to join councils, UBCs, how does it work? Do I need to, put in a certain amount of time? Usually the answer is no. I'm giving you a trick now, haha. But that's something that makes you wanted, because then you're posing yourself to be a value for the hospital. So if you're screwed up, permit my word, if you messed up all the questions that, I mean, you can't possibly mess up all the questions, but let's say you were unsure about some questions that you had during your interview, this is something that can set you back on the consideration board. You get? So that's something that always stands out. And the favorite question that many people are afraid of asking, or just like flat out ask the first two questions. Your pay, right? Please, I would say never ask about your pay first. Like, once they say, do you have any questions? Don't go jumping, yeah, so how much do you pay? Or, questions relating to benefits. I think it should come last. So build your way. You don't want to like overwhelm them and ask multiple questions. But these are like a list of different things you can ask before you go into the pay. So definitely you can ask, oh, what's the pay going to look like? How can I anticipate, what can I anticipate my pay to look like? And another thing that comes to mind now is the nurse to patient ratio. Yeah, nurse to patient ratio. Now that helps you to know, is this the right fit for me or maybe not? And it also lets them know that you're serious. You know what's going on. You know what you're trying to set yourself up for. And that's when you see managers. You can always know the atmosphere. Sorry, you can always see the atmosphere when they ask that question. If people are like, well, typically, and they give you, maybe sometimes we have 5-1, but we try to strive for 4-1. You're gonna get 5-1, not 4-1, unless you're in California. But so these are things that helps you to know what exactly you want to sign up for. So That's this for this portion of the video. I'm trying to keep them 5 minutes long, and I'll see you in my next interviewing series, okay? Bye.